Well, the threat level, as you were saying there, moving to 5, where it hasn't been before, tells you all you really need to know about the level of emergency that we're at here. That means that we are, in the jargon used in Whitehall, at material risk of the NHS being overwhelmed within 21 days. The tier system, introduced really not that long ago. The Health Secretary was touring the studios this morning and saying it isn't working. And there was no way the government was going to leave that tier system there for long. And it looks like tonight at 8 o'clock it's going to be announced that it is de facto disappearing. We're all moving into a top tier, and we get a glimpse, I think, of what that will mean from what Nicola Sturgeon, Scotland's First Minister, said today. The measures that are coming in Scotland have a very strong echo of the March lockdown, more severe than the one we went through in November. And that means you might be wondering, what remaining freedoms do I have that could be restricted? Well, things like being able to go and worship, being able to meet more than one person outdoors, and that invocation that was there back in March that you must stay indoors unless you have an exemption very carefully listed in the legislation then, and I suspect in the new legislation. Unless you have an exemption, you must stay indoors, and that will be backed up by law. What we have now is a race, really. These measures have to work and give space for the vaccine to roll out. And there is a worry in parts of the scientific establishment that maybe these restrictions, even though they are draconian and as tough as anything we've had, we suspect, they may not quite do the job. It might be that the new mutation of the virus still carries on galloping around the country at the rate at which it's doing, or probably lower, but still at a dangerous rate. That's what they're trying to control. That's what they hope the measures tonight will control, and that's what we will hear about on Channel 4 News at 8 o'clock.
Well, now, people across the United Kingdom have begun receiving the first doses of the new Oxford-AstraZeneca vaccine, but it's becoming a desperate race to increase the scale and the speed of the vaccination programme. And apart from promises, there are few details from ministers about just how that can happen. Our Health and Social Care editor, Victoria MacDonald, has this report.
You're the first patient to have it.
Oh, that's
Isn't that
great.
fantastic?
Yeah.
It was meant to be yet another celebration, the first patients receiving the highly anticipated Oxford-AstraZeneca COVID-19 vaccine.
In fairness, that's great. Well, the vaccine means everything to me. I mean, to my mind, it's the only way of getting back to a bit of normal life. You know, this virus is terrible, isn't it?
But it has been overshadowed by a statement released tonight by the UK's chief medical officers, raising the alert level from 4 to 5. In a statement, they said, "We are not confident that the NHS can handle a further sustained rise in cases, and without further action, there is a material risk of the NHS in several areas being overwhelmed over the next 21 days. They said cases were rising almost everywhere. Between Christmas Day and yesterday, there was a 41% increase in the number of confirmed coronavirus patients in hospital in England alone. The Joint Biosecurity Centre advised in light of this that stricter measures were needed. The vaccination rollout has now become even more desperate. Nobody doubts the sheer scale of it. There are more than 36 million people on the priority list, but as of last Thursday, the latest figures available, just under 1 million have so far received their COVID jab. And the 530,000 doses delivered by AstraZeneca is certainly far lower than the numbers previously promised. In May, the business secretary told the nation this.
AstraZeneca will work to make 30 million doses available by September for the UK.
In November, the then head of the UK government vaccine task force told a Commons committee that they had low millions in bulk, though not in vials, and another vat in production.
So that will give us that should get us probably up to about 4 million doses that we should have by the end of the year.
This one here, this one here.
And in December, a report from academics said 2 million vaccines needed to be given out each week. So today, the Prime Minister was asked, Where are those doses?
It's not so much a manufacturing issue, though that is part of it. It's also that each batch needs to be properly approved and quality controlled.
The MHRA said it had fully scaled up batch testing, leaving the shortage even more mysterious. The combination of the new mutation and not enough vaccine did lead controversially to the decision to give the first and second doses up to 12 weeks rather than 3 to 4 weeks apart. And tonight, somewhat reluctant support has now come from leading immunologists, but with a warning.
On balance, we don't think that there's going to be harm in doing this. And so we are supporting that the interval between the two doses would be 12 weeks, but no more than 12 weeks. And we want to stress that it's really, really important to have the second dose.
It turns out, too, that red tape is hampering those who want to volunteer to administer the vaccines. The NHS Professionals website asks for details on immunisations and allergic reactions. All fair enough, one now ex-volunteer said. But then came the next modules.
So I spent 4 or 5 hours that evening doing the online learning, which was very good and informative, and the assessments, and then came to upload the documentation to the website to discover that they wanted another 10 or 12 pieces of evidence around manual handling, conflict resolution, preventing radicalisation, fire safety, etc., which seemed unnecessary. And unfortunately, I don't have the time to be doing things that are not relevant.
A retired nurse told Channel 4 News that she had been asked to provide all details of all employers and contacts back to 1975, as well as proof of childhood vaccinations. The NHS has now agreed to streamline the system, the Health Secretary himself saying the radicalisation section was not needed.
So you're happy if I swab my vial?
And tonight's news making it all the more urgent that as many volunteers as possible can jab as many arms as are willing.
Victoria MacDonald, well, let's take a look at the vaccination numbers and how fast the scheme can realistically be accelerated to protect every adult in the country. The UK is currently vaccinating an average of 300,000 people a week. If we continue at that rate, it will take over 6 years until October 2027 for every adult in the UK to receive 2 doses of a COVID-19 vaccine. If we increase this to 1 million vaccinations a week, it will take 2 years to complete. And if the government manages to ramp up vaccinations to 2 million a week, every adult in the UK could be fully vaccinated by February 2022. Well, Christina Pagel is a health research mathematician and member of the independent SAGE group, and she joins me now. Now, at 8 o'clock, Boris Johnson is expected to announce a new lockdown. You have been calling for this increasingly desperately for many days now. What does he need to do? What's the test for you as to whether he's got it right?
Well, the minimum is to go back to where we were in March, which means closing schools, closing universities, don't leave home, all of that. But that on its own isn't enough. I mean, maybe in spring, R got down to maybe 0.6 at its lowest. And with the new variant, we know it can add up to 0.4, 0.5 on. So that wouldn't bring cases down on its own. So you have to look at where else are people transmitting. We know that essential workers, people working outside the home who have no choice, like delivery people, people in factories, people in shops and retail, all were at high risk in wave 1. We need to protect them. We need to pay people to isolate. We need to help people isolate outside the home if they're in overcrowded housing. We have to do everything we can to try and prevent transmission. And there are all these things that we haven't even tried yet.
Now, all the mood music over the last sort of month has been, if we can just get over the next couple of months, it's going to be OK, as we get into spring with the vaccination. But if you look at the vaccination numbers, is that realistic? If it's going to take a year to vaccinate everybody, by which time the virus might have mutated and the vaccine is out of date, what good is it?
I mean, the point about mutation is a really good one. If the virus carries on circulating at a high level, even if the vulnerable people have been vaccinated and the NHS is OK, then you're creating opportunities for it to mutate and escape, what they call escape the vaccine. So we have to go now for a really strong elimination strategy. That's the way to keep us safe and to keep the world safe. You know, we have a responsibility not to let it mutate further. We don't want to be doing COVID part 3 in 2024. You know, we have to stamp it out now. And that means using the vaccine that we know works, vaccinating as many people as we can, as quickly as we can, and driving cases down and down and down so it doesn't get opportunities to mutate further.
But is it the case that if you vaccinate the over 65s, then you've basically solved the problem? You stop the deaths and we can start, you know, getting back to, well, I don't want to use normal, but we can get back to something.
You've solved one of the problems. You probably will bring deaths down massively. You haven't solved the problem of long COVID, which we know affects perhaps 10% of people who get it, regardless of age. And you haven't stopped the problem of mutation. If it then mutates to make the vaccine not effective, then everyone who was vaccinated before is no longer protected. So it doesn't, you can't just say, oh, I'll vaccinate the 20 million vulnerable people and let everyone else get it, and that's fine.
But is this lockdown going to be determined, the duration of this lockdown, going to be determined by the success of the vaccination programme or by the success of the measures themselves and seeing the R rate coming down?
Both. I mean, it has to be both. And that's kind of what I want to hear from Boris Johnson today is actually, you know, a plan. Not it's going to be 2 weeks or 3 weeks, but where do we have to be before you can release restrictions? How many people do we have to vaccinate? How many vaccines do we have? What is our priorities? Are we going to prioritise key workers, for instance, who work outside the home? How do we support education? All of that has to come together. You can't just take one thing and say, oh, it's if we vaccinated this many people, or if R is here, or if cases are here, or hospitals are here. All of it has to work together.
Christina Parkle, thank you very much indeed.